Assalamu alaikum everyone, this is RPHVR and welcome to the platform of Pharmapedia once again with a new video of the drug series that is Amikacin, and this is the drug 11 of the drug series. So let's begin the video. Amikacin available in the brand name Amikacin, that is the generic name. Also obviously is belong to the class of the drug aminoglycoside. And what is the major adverse effect of this classification? That is so obvious, it's nephrotoxicity and ototoxicity. This is basically the tip point for all the pharmacists, so I described this point at the starting of the video. Now, dosage, form and strength in the injectable solution: 50 mg per ml, 250 mg per ml, and its journal dosing consideration. In the peds, 15 mg per kg per day. It is also given in the same dosing in adults. In the UTI, 250 mg IV IM every 12 hours and extended interval dosing for every 24 hours. First dose, obviously with the above mentioned dose calculation, 15 mg per kg IV based on the lean body weight, and the subsequent dosing, consult your pharmacist. So you should know about the basic dosing consideration if the patient asks you about the dosing. Now in the hospital acquired pneumonia, 20 mg per kg per day, because it is a more serious condition, and administer with the anti-pseudomonal beta-lactam or carbapenem. What is the anti-pseudomonal beta-lactam? Give an at least two example of the anti-pseudomonal beta-lactam in the comment box. Now, dosing modification, its dose must be altered in the renal impairment. Why? Because it is highly nephrotoxic along with the ototoxic. With a creatinine clearance greater than 90 ml per min and age less than 60 years, every 8 hourly, and the creatinine clearance 60 to 90 ml or age greater than 60 years or equal to the 60 years, every 12 hourly. Creatinine clearance between 25 to 60 ml, and the frequency must be OD. Creatinine clearance 10 to 25 ml per min every 48 hours, and with the more creatinine clearance, the duration will be more, and with the less creatinine clearance, the duration will ultimately increases, that is every 72 hours. How you can calculate the creatinine clearance? Creatinine clearance is calculated by the CK formula as I described in my other videos. Dosing consideration: monitor the peak, trough, and the renal auditory functions. Why auditory functions? Because it is ototoxic. And why the renal functions? Because it is nephrotoxic. Peak level 15 to 40 mg per liter and trough 5 to 10 mg per liter. So what's next? Next is the aminoglycoside use. Why aminoglycoside use? Because amikacin is naturally aminoglycoside. So what is the major uses of amikacin? It is indicated in the sepsis condition, in the UTI, bone and the joints infection, and obviously in the hospital acquired pneumonia. Mechanism of action: it irreversibly binds to 30S subunit of the bacterial ribosome, block the recognition step in the protein synthesis. So ultimately there is no protein synthesis, so it inhibit the growth of the bacteria. For the gram-negative bacterial coverage of infection, resistance to the gentamicin and tobramycin. And these are some basic classification of aminoglycoside drug, and the drug include in this classification tanks. And the basic features of the aminoglycoside: amino against aerobic gram-negative mainly bactericidal, inhibit the protein synthesis at the 30S subunit, and nephrotoxic and ototoxic. Side effect of aminoglycoside include nano. Now its absorption and distribution pattern. IM absorption may be delayed in the band-ridden patient. Peak plasma time IM 45 to 120 minute. Distribution: protein bound 0 to 11%, and VD is the volume of distribution. Elimination half life that is 2 to 3 hours in the normal renal function, and excretion urine 94 to 96%. These are the basically important features of amikacin. Now in the pregnancy and lactation, it lie in the category D. And in lactation, it excrete in the milk, unknown, not recommended because it is not safe, because overall it is antibiotic. And as you can see in the FDA pregnancy categories D, positive evidence for risks to human fetus, but benefit may outweigh risks of the drug. Now it's contraindication, and it is contraindication in this condition. And what is this condition? It is basically the menesthesia gravis, and it is contraindicated in the menesthesia gravis. Precautions: ensure adequate hydration, renal impairment, interactions with furosemide, ethacranic acid, anesthetic, neuromuscular blocking drug, and its adverse effect are ototoxic and nephrotoxic. And that's all about this drug and this video. Meet with a new drug with a new topic in the next video. Till that, Allah Hafiz, take care.